So welcome everybody. I'm Ann Gilliland. I'm the Scholarly Communications Officer for the University Libraries, and I'm pleased to be here to moderate this panel for Open Access Week. The panel today is on open access issues for graduate students. Open access is a concept that's been gaining traction over the last few years. There are many flavors and types of open access being tried out and bandied around, including preprint, open preprints, open material at the time of publication, and also opening research after an embargo. Some open access focuses on journal articles, others focuses on open data. Today we have three speakers who are going to talk about their points of view and experiences with open access in a variety of subjects. They are Shrikant Bangdiwala, who is a research professor in biostatistics, Justin Kreft, who is a graduate student at SILS and also at the School of Government, is that correct? Yes. And Hillary Miller, who is also a graduate student at SILS. And so I thought I would start with you, Dr. Bangdiwala, to ask you why you were interested in it. When we asked you to be on this panel, why did you say yes? What does open access mean to you?
Okay, well, so open access as a researcher is important to me for having a wider dissemination of my research. And so, especially in countries that have poor resources, having students or graduate students or junior faculty or senior researchers having access to what I've developed would be important to me. So having wider dissemination and having them having access to my research is what I would like to have as open access, or what I understand as open access.
And for you, Mr. Kreft?
Open access to me, the way I've gotten into it is from the government standpoint. I work with Wake County on their open data policy right now. And open data and open access is very important because it provides a transparent layer for citizens and the public to interact with organizations and keep them more accountable, theoretically, if they engage. Also, publication of information can be used to generate apps and GIS models and things that can actually provide a public good. I've got lots of examples of those, but
why don't you give us one now?
Well, recently it's a simple one. Recently, we published all of the county's health inspection records to Yelp. And it sounds really silly, but it's very important to have health inspection records tied to restaurants to make them accountable. And since users go to Yelp to access restaurants, the best place to publish them would be Yelp. That very small thing has driven quite a few innovations and apps that allow citizens to track health inspection data for restaurants and keep them accountable. So this is a mild victory for Wake County. We're one of the first counties in the East Coast to ever do it.
And you, Ms. Miller?
Well, as a student at SILS, I have an assistant position in the e-resources division of our library, and I have experienced firsthand some of the difficulties in getting access just for a research institution's patrons for the resources that we need. And so knowing the high cost and the increasing cost of that, I worry about when I'm not a student or maybe not affiliated with an academic institution someday, how I'm going to be able to access the same resources.
And I want to now tell both our panelists and the other people who are listening in, if you've got questions or comments, please feel free to voice those at any time, especially you panelists if you have questions or comments for each other, so that this doesn't become the four-way interrogation. So, Dr. Bangdiwala, do you have examples of times when people in the developing world or in less advantaged areas have been able to use your research or have not been because it was or wasn't open access?
Well, not specific examples, but what I have noticed is that before there was open access, so several years ago, I would, on a regular basis, before the internet, I would used to get little postcards with folks wanting to get copies of reprint
Yes.
of a publication. After the internet came around, then I started to get emails asking for the PDFs of some of my articles, and they would usually be coming from Eastern Europe, from South America, and from Asia, very little from Africa. And now that many of the journals that I've been publishing in do have open access, I have less requests because I'm assuming that people are able to now get it. But I still get some requests from places, researchers that are at institutions that don't have access to major journals. That's, I guess, still a concern. I can give you another example of what, difficulty is on both sides. One side is you want to have your research be more widely available, so your publications to be more widely available, but also paying for the costs of having an article be open access is somewhat prohibitive for a regular researcher. In fact, I was able to do it last year thanks to a partial subsidy from the UNC's Health Sciences Library, but I still had to use some personal funds to make it up. And that sort of allows only one article per year to go to an open access journal, because the fees charged by open access journals are extremely high for us in the United States. I don't know if they have different rates for people in different settings, but at least for us in the United States, it becomes prohibitively expensive for an individual that doesn't have the department or school or university subsidy to be able to do it. One answer to that is maybe, since most of what we do is funded by research grants from the National Institutes of Health or some other major funders, is to build it into our budget, which is usually not to the liking of the funding agency. I can give you one counterexample, and that is we got funding to do some work, some methodologic development work with the European Union, and they forced us to do it all open access.
Yes.
So by forcing us, they also made us, they funded it to do that. So we published, the software we developed was an open access software, and the publication was open access, and so both of those things were funded. So those are several examples of what are some of the constraints that one is under, but some of the benefits. So since that software, for example, was published in open access, it's been used at least 1,000 times already.
Yeah, and we see that in many cases a mandate from a funding agency is very effective in making it easier to make articles open. And I was wondering for you two, if you have examples, and perhaps more examples for you, of material where you feel that urgency for it to be open.
You want to take it? Me first? Okay. So there's a lot of material that needs to be opened, and partly because of the impact it can make if it's open. And a lot of it, again, for me, is government information, but health services information is a real huge thing that we want to get out there, because if we can provide robust big data sets to researchers, we can possibly get better research. The great thing about open access in general as a concept is it's viral in nature. So the more open access that's out there, it drives more open access, theoretically. And so when governments are taking the lead and trying to make sure that large data sets of aggregated data are out there, that's just a boon to researchers. So I think really, for me, it's getting all the wealth of information the government collects while still protecting the privacy concerns. But those things have been what's been most interesting to me in general, and probably the biggest targets. Now, this is slightly different than the whole scholarly publication, but I think they're related.
There is a relationship, definitely.
In terms of trying to get the data itself out there, which I'd be interested in hearing more about.
I think coming from a background right now in the social sciences and also having studied the humanities, that there's sort of a sense of less immediacy with getting an article open right at that very moment when it's published, and so sometimes embargo periods might be longer. But there are a lot of things, especially in the field of library science, there's a lot of new information that has to do with new cutting edge trends, and people, professors, students, researchers need that kind of information to stay relevant to their field, and also practitioners really need that information as soon as it comes out in order to, increase the benefits of their practice.
And so, Justin, did you have some other something you were going to ask Dr. Bangdiwala about?
I guess I was curious about how does data, what about data? I mean, publishing original research and disseminating that in open formats. You spoke a little bit about the scholarly articles, but is there movement in that, or in your opinion?
Yeah, so I can tell you a little bit about my experience, and it's sort of, there's a lot of variation here. A lot of it has to do with the funding agency. And many times the funding agency owns the data, and it's not the principal investigator that owns the data. It all depends on the contract or what arrangement is made between the funding agency and the investigator. Sometimes one has to do with, if there's a contract, there are deliverables, and so one may have to deliver the data to the funding agency, and it's up to the funding agency then to share it or not. Most of the work that I've been involved with has been with the National Institutes of Health, and the NIH as a funding agency wants their data to be widely used because the data is collected with funds that come from U.S. taxpayers, of course. And so they want to make it available for use. There usually is a time embargo so that the investigators that have spent years collecting the data have, so to speak, first dibs on using it for maybe 1 year, 2 years, 3 years, 5 years, whatever, that what varies. And after it's collected or delivered to the NIH, they sometimes also have that whoever can access it is not just anybody off the street. It has to be somebody who writes a research proposal to use the data, what's the purpose of having access to it, and so forth. And so there's all sorts of arrangements. Sometimes the data are available through a data repository or an archive. And I can give you a specific example. We collected data in the longitudinal study of child abuse and neglect, and every 2 years we had to deliver the next wave of data to the National Archives of Child Abuse and Neglect. And however, we as investigators still have the option of who uses it according to a proposal that they write for getting access to it. So it's free access that some people can get to it, but it's not open, widely open that anybody can just, decide I want to get access to it. It has to be some sort of research proposal to use it. So it's somewhat cumbersome process, but that's what that funding agency did. And so it varies by funding agency, and whatever grant agreement there is or contractual agreement is in the funding process. Data that somebody may, collect in their own laboratory or simulate for examples, etc. They own it, and they may do whatever they want to. Unfortunately, I've been trying to get a handle of data that was published in a paper in 1994 to use in class, and I have not been able to get the author to reply to my emails. So it happens all over.
Yeah, I've had the same experience. There's somebody who has some data from about the same time period, and my guess is she doesn't know where it is anymore, but who knows. So I wondered if the speed bumps that some funding agencies put in before another researcher can access that data, do you think that those are mostly motivated by ownership issues or privacy issues?
No, I think it's just they don't want somebody that doesn't know, that doesn't have the credentials to properly handle the data, to handle the data. Because I think it is, I don't think it's any privacy issue, because usually when you deliver data, it's all de-identified. And there is all sorts of securities to protect the privacy and confidentiality of the information. But I think it is, one of the fears is that, all researchers have is, maybe I screwed up in the analysis, and now somebody's going to throw egg on my face because I didn't do it properly. So that may keep you from wanting to have others try to reproduce your analysis. But I think these, as you call them, the speed bumps are there to maybe make sure that whoever's requesting it knows what they're doing. Is my view.
A question, if you don't mind, are those data sets discoverable in any way, or does one have to know to go to a particular agency to request them? How would a researcher discover those data sets and to apply to use them?
And unfortunately, there is no registry of data sets that I know of. They are usually tend to be the archives tend to be subject specific. So if you're working in child abuse and neglect, somehow you will learn that there is this National Archive of Child Abuse and Neglect data sets, but they only have the data sets that are funded by the National Center for Child Abuse and Neglect. So they're not funded to be a data repository for any study that is done on child abuse and neglect. And different funding agencies may have their own rules. So yes, it's discovering where the data sets are is really difficult, I think. The UNC Injury Prevention Research Center, we tried to create a booklet, in fact, I think it was in the 1990s, that actually one of the graduate students did, that was to try to find out where are the different data sets related to the injury field in the United States, from the CDC, from the other different sources. And we were not holding the data, we were just documenting where they are and how somebody would go about asking for it. But of course, that was just a project, and it has to be maintained, and there is no funding to maintain it. So it's finding where the data sets are is another issue.
Thank you.
Especially for you two who are starting your careers, how do you weigh publishing in an open access environment? Where, some people are absolutely firm that they will only publish open access. Other people are more flexible or pragmatic or whatever you want to call it. And of course, and other people's feelings about this evolve over time. So how do you feel now, and has that changed?
In theory, for me, I very strongly support open access. I want to publish open access. But as someone who, all I really know and understand about the tenure process in, a job where I would be, a faculty member or someone in an academic institution, is that I need to publish in the journals that have the highest reputations in my field, which may not be open access. And so there is definitely a struggle there with the worry of, publishing in something that is going to help my career versus my conscience.
Absolutely. And on the data side of it, I think Dr. Bangdiwala said something. I mean, data owners are protective over their data for a myriad of reasons. I mean, and even at the governmental level, you have to convince them to open that information up to the unwashed masses. Literally having people who you don't necessarily know or trust or even ever will know mess with it and touch it and analyze it and work with it and break it even possibly. And you have to be comfortable with their interpretations even if they make mistakes, because you're opening that information up. And that's dangerous because knowledge is power, and you're able to control the narrative better if only your report gets out. And you can see that in the government very clearly. Departments are very careful about what they release. They would rather just give out that annual report because no one's going to check what 35% means, or probably. And it's not a knock against researchers for wanting to do that. I think it's a natural human reaction to try to protect the territory and the work that they've done. We have to fight those urges though, because we gain so much by letting more interested people and engaging more people and getting more conversation. I think open access is about cultivating relationships more than the data itself. It's about connecting to people and empowering through collective action. And that's a hard thing to do when we traditionally kind of think of ourselves as the holders of information and like the gatekeepers of important information. But I could see myself falling into the same traps because I think it's a natural thing.
I think similar to that is what's called, is it called the intruder problem with young, professionals, or I've heard it a lot as a graduate student, the feeling that you're new to the field and you don't quite belong and you might not have anything really worthy of contributing. And so one of the attractive things about, journals that aren't necessarily open access is the really strong peer review process, where I know they work with authors. If your work or your research isn't quite up to par, they'll work with you and help you get there. And so that's something attractive about that you don't see maybe as much in open access journals.
Yeah, depending on the journal.
Mm-hmm.
Yeah. I wonder, for any of you, what you think would need to change or happen in order for open access to become more prevalent, especially open access without additional author fees.
Can you repeat the question? I didn't really hear you very well.
What do you think would need to change or happen in order for open access to become more prevalent?
Silence in the room.
Silence.
Yeah, it's a difficult.
Yeah.
I think as long as you have groups or third-party people going out and profiting through gathering information together and putting them, like going to these different sources and profiting off of indexing them and putting them all together and making them available to people, then the cost will always be very high because there's a profit margin that they're working towards, and they get subscription fees, and they get money on the front end and the back end, and it's worth a lot of money. It's a lot of work to index all that. I mean, as a sales person, I recognize how much the work that is, but I don't know that that's necessarily sustainable or healthy for the long term. If our goal is to get open access, that's not necessarily going to do it.
think a stronger adoption of things like the green open access model, where you can deposit like a preprint version in some repository, but the problem is some people comply, some people don't, and then it's really hard to bring all that stuff together, that value added service that so many publishers or vendors bring to the field of publishing.
Stronger professional standards for any organizing body that you belong to would certainly help. If your organization sits down and says, this is the way we're going to do it, if universities actually got around and said, yeah, this is the way we want to do it, and they forced researchers to do it, I think taking out a lot of choices might help. Pushing individual choices is hard to fight.
Yeah, that would work.
That would work. I don't know if we want it, but it would work.